Hi, I'm Dr. Bhargav Raut from PathoFast Lab in Pune, and today I'm going to tell you what is the meaning of a negative pregnancy test. So, a negative pregnancy test basically implies that the level of the substance that the test checks for is below a certain cutoff. Now, what does this mean? Most pregnancy tests measure the level of a hormone called the Beta-HCG or beta human chorionic gonadotrophin in the mother's blood or urine, depending on which test you took. Both the tests, whether it's a blood test or a urine test, will just try to check whether the levels of this hormone are above a certain cutoff. For blood tests, this cutoff is usually 5 MIU per ml, and for urine tests, the cutoff is around 20 to 25 MIU per ml. Now, if let's say that you took a blood test and your blood test came back as negative, what it means is that the level of the Beta-HCG is less than 5 MIU per ml. On the other hand, if you took a urine test and it came back as negative, it's the same thing. It means that the level is below 20 or 25, whatever is the detection threshold of that test. So urine tests have a higher detection threshold. They can only begin to detect the Beta-HCG when it is at least 20 to 25 MIU per ml, whereas blood tests can detect it even if it's just 5 MIU per ml. A negative test basically means that the Beta-HCG level is not detectable, and that implies that you're not pregnant. That is because the Beta-HCG level almost always only rises if you are pregnant. In women who are not pregnant, the level will be usually less than 5. In most women it will be 0. Are there any other situations in which you can get a negative pregnancy test? Yes, there are 3 situations. The first one is if you test too early. What you have to remember is that even the best blood tests can only give you a positive pregnancy test result if you do it at least 10 days after conception. Conception is when the egg and the sperm unite and form the embryo. Relative to your periods, you can only rely on a negative pregnancy test if it is done at least 15 to 17 days from the midpoint of your cycle, or at least 30 to 31 days after your last period. This is the earliest possible time when a blood test can reliably tell you whether it is negative or not. For urine tests, this time is even longer. So we usually say that for a urine test, you should take it at least 10 to 14 days after conception, and for a blood test at least 10 days after conception. Secondly, the urine test has another disadvantage, is that if you drink a lot of water before taking the test, it can give you a false negative result. It can completely miss the pregnancy. Because your urine gets diluted, the Beta-HCG hormone level also gets diluted, and these tests can fail completely. Thirdly, if you took an at-home test and didn't follow the test instructions properly, you can still get a false negative result. So you should remember these things if you get a negative pregnancy test.